Julia Blaze pressed her fingers against her ribs, wincing as the sharp pain shot through her chest like lightning. The 22-year-old nursing student sat in her Toyota Camry outside St. Catherine's Hospital in Denver, Colorado, staring at the medical report in her trembling hands. 3 words jumped off the page: multiple rib fractures. For 6 months, her parents had called her dramatic. Her friends said she was overthinking. Even her boyfriend Marcus had rolled his eyes when she mentioned the constant aching that kept her awake at night. But here it was, black and white proof that her body had been screaming the truth all along. This is the story of how Julia learned that sometimes the people who love you most can be the ones who hurt you deepest, simply by refusing to listen. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow I've saved something extra special for you. The morning sun streamed through the windows of the Blaze family's 2-story colonial home in Lakewood, a suburb just west of Denver. Julia had always loved mornings in this house. The way her mother, Sarah, hummed while making coffee, how her father, Robert, would shuffle downstairs in his worn slippers, grumbling good-naturedly about the newspaper delivery boy's aim. Her younger brother, Tyler, would bound down the stairs 2 at a time, always running late for something. It was a picture-perfect American family, the kind that neighbors envied, and that Julia had never questioned until recently. Robert Blaze worked as a senior project manager for a construction company, while Sarah taught 3rd grade at the local elementary school. They were the type of parents who attended every school function, who had Julia's honor roll certificates magneted to the refrigerator, and who spoke proudly of their daughter's acceptance into the University of Colorado's competitive nursing program. Julia had inherited her mother's auburn hair and her father's determined green eyes. Standing at 5'6", with an athletic build from years of high school volleyball, she was the poster child for wholesome American youth. Her bedroom walls were covered with motivational quotes, nursing textbooks, and photos of her with friends from her sorority, Alpha Delta Pi. The Blaze household operated on routine and predictability. Sunday dinners were sacred: Sarah's pot roast, Robert's stories from work, Tyler's dramatic recounting of his latest high school adventures, and Julia's updates about her studies and her relationship with Marcus Chen, her boyfriend of 2 years. Marcus was everything her parents approved of: pre-med at CU Boulder, polite, ambitious, and from a good family. Julia's life seemed perfectly mapped out. She was in her 3rd year of nursing school, maintaining a 3.7 GPA while working part-time at a local clinic. Her plan was straightforward: graduate next year, pass her NCLEX exam, work as a registered nurse for a few years, then potentially pursue her master's degree to become a nurse practitioner. Marcus would finish medical school, they'd get married, maybe move to a nice suburb like the one she grew up in, and continue the cycle. But perfection, Julia was learning, could be fragile. The first signs that something was wrong began on a crisp October morning. Julia was getting ready for her advanced pathophysiology class when she felt a strange twinge in her chest. She was reaching for her textbook on the top shelf when a sharp pain shot through her left side. She paused, hand frozen mid-reach, waiting for it to pass. When it did, she shrugged it off. Maybe she'd slept wrong or pulled something during her morning run. The Blaze family had always prided themselves on being tough. Robert often told stories of working construction sites with minor injuries, never complaining, never taking sick days. Sarah had a similar philosophy. She'd taught through migraines, food poisoning, and even a sprained ankle, believing that showing up was more important than feeling good. This mentality had been passed down to both children. Tyler once played an entire soccer game with a dislocated finger, and Julia had never missed school for anything less than a fever over 101 degrees. "Pain builds character" was one of Robert's favorite sayings, usually delivered with a hearty pat on the back that was meant to be encouraging, but often left Julia feeling like her discomfort was somehow a personal failing. So when the pain persisted over the next few days, Julia didn't mention it at the dinner table. She was a nursing student, after all. She understood anatomy and physiology. If something were seriously wrong, she would know, wouldn't she? The human body was designed to heal itself from minor injuries. This would pass. But it didn't pass. By the end of October, the pain had become a constant companion. It was worst in the mornings when she first got out of bed, a sharp, stabbing sensation that made her catch her breath. It hurt to laugh, to cough, to take deep breaths. She found herself unconsciously favoring her left side, walking slightly hunched over and avoiding movements that might trigger the worst of it. Her roommate at the sorority house, Jessica Martinez, was the first to notice. "Girl, you're walking like my grandmother after her hip replacement. What's going on?" Julia looked up from her Fundamentals of Nursing Care textbook, realizing she'd been unconsciously holding her side. "Just some muscle soreness, probably from that new workout routine." Jessica raised an eyebrow. "What workout routine? You've been skipping the gym for weeks." It was true. Julia, who had been religious about her fitness routine since high school, had been finding excuses to avoid exercise. The elliptical machine made the pain worse. Even walking across campus left her winded and hurting. "I'm fine, Jess, just stressed about midterms." But Julia wasn't fine, and deep down she knew it. The pain was unlike anything she'd experienced before. It wasn't the dull ache of sore muscles or the sharp but brief pain of a cramp. This was persistent, localized, and seemed to be getting worse rather than better. At night, she found herself unable to sleep on her left side, which had always been her preferred position. She'd lie awake staring at the ceiling, one hand pressed gently against her ribs, trying to understand what was happening to her body. Her grades began to suffer. The girl who had never received anything below a B+ found herself struggling to concentrate during lectures. The pain was distracting, making it hard to focus on complex medical terminology and procedures. She'd catch herself zoning out during Professor Williams' pharmacology class, missing important information about drug interactions and dosages. During clinical rotations at Denver General Hospital, Julia struggled to keep up with the physical demands of nursing. Lifting patients, bending over beds, and standing for long periods all aggravated whatever was wrong with her ribs. She began volunteering for desk duties and documentation tasks, anything that would keep her stationary and relatively pain-free. Her supervising nurse, Margaret Thompson, a stern woman with 30 years of experience, noticed the change immediately. "Blaze," she said one afternoon, cornering Julia at the nurse's station, "you've been moving like you're made of glass. What's wrong?" Julia hesitated. In the hierarchy of hospital life, admitting weakness felt dangerous, especially as a student. "Nothing's wrong, Mrs. Thompson. Just a little tired." Margaret's eyes narrowed. She'd seen enough students try to push through injuries and illness. "Tired doesn't make you flinch when you breathe. When's the last time you saw a doctor?" The question hung in the air. When was the last time Julia had seen a doctor? Her family that always been healthy, visiting their family physician, Dr. Anderson, only for annual checkups and the occasional bout of strep throat. The Blazes weren't the type to run to the doctor for every ache and pain. They handled things themselves, with rest, over-the-counter medication, and time. "I'm fine," Julia insisted, but even as she said it, she could hear how hollow the words sounded. Margaret studied her for a long moment, then shook her head. "Fine, but if you collapse on my floor, don't expect sympathy. We've got real patients to worry about." That evening, Julia sat in her car in the hospital parking lot, key in the ignition, but unable to bring herself to start the engine. Margaret's words echoed in her head. Maybe she should see a doctor. Maybe this wasn't something that would just go away on its own. But the thought of going home and telling her parents she needed medical attention filled her with dread. She could already hear her father's voice. "What do you mean you need to see a doctor? For what, some soreness? Julia, you're tougher than that." And her mother would worry, but in that particular way that made Julia feel guilty for causing concern. Sarah Blaze had a tendency to catastrophize, to imagine the worst-case scenario, and then to blame herself for not preventing it. No, Julia decided, as she finally started her car. She would handle this herself. She was almost a nurse, after all. She understood the human body better than most people her age. Whatever was wrong, she could figure it out and treat it appropriately. She just needed more time, more rest, maybe some better pain management techniques. As she drove home through the Denver suburbs, past the neat houses with their perfectly manicured lawns and the families visible through lit windows, Julia tried to convince herself that everything would be okay. Pain was temporary. Bodies healed. She was young and strong and smart. But deep in her chest, something that felt very much like her intuition was whispering that this was only the beginning. Preparing and narrating this story took us a lot of time. So if you are enjoying it, subscribe to our channel. It means a lot to us. Now, back to the story. The moment that changed everything happened on a cold November evening during Thanksgiving break. Julia had driven home from Boulder, looking forward to a week away from clinical rotations and the mounting pressure of her studies. The pain in her ribs had become her secret companion over the past month, a constant reminder that something in her carefully ordered world was shifting. She pulled into the familiar driveway of her childhood home, noting the new string of lights her father had hung along the gutters. The house looked exactly as it always did, welcoming, stable, unchanged. But as Julia stepped out of her car, a sudden gust of Colorado wind caught her off guard. She instinctively braced herself, and the sharp movement sent a lightning bolt of pain through her chest that was unlike anything she'd experienced before. Julia gasped, doubling over beside her car, one hand pressed against her ribs. The pain was so intense it brought tears to her eyes. For a terrifying moment, she couldn't catch her breath, and she wondered if she might actually be having a heart attack. But she was only 22. Heart attacks didn't happen to healthy college students, did they? "Julia, honey, are you okay?" Her mother's voice came from the front porch, filled with immediate concern. Julia straightened slowly, forcing a smile despite the throbbing in her chest. "I'm fine, Mom. Just got the wind knocked out of me." The lie came so easily she almost believed it herself. Sarah Blaze hurried down the walkway, her teacher instincts kicking in. She had the same look she got when one of her third graders fell on the playground. Alert, caring, but expecting the crisis to be minor and easily resolved. "You look pale, sweetheart. Are you getting sick? Please tell me you're not coming down with something right before Thanksgiving." "I'm not sick," Julia insisted, grabbing her overnight bag from the back seat. The movement sent another wave of pain through her ribs, but she gritted her teeth and powered through it. Just tired from the drive. That first dinner back home was torture. Julia sat at the familiar dining room table, surrounded by her family's cheerful chatter, but every laugh, every deep breath, every slight movement sent pain shooting through her torso. She found herself eating mechanically, barely participating in the conversation about Tyler's upcoming basketball season and her father's latest project at work. "You're quiet tonight, kiddo," Robert observed, reaching for the mashed potatoes. "Nursing school wearing you down?" Julia looked up to find 3 pairs of eyes watching her with varying degrees of concern and curiosity. This was her moment, the opening she'd been unconsciously waiting for. She could tell them about the pain, about the weeks of discomfort that were getting progressively worse. She could ask for help. Instead, she heard herself saying, "Just a big exam coming up. Pharmacology is kicking my butt." Tyler grinned. "At least we're not taking AP chemistry with Mr. Peterson. That guy assigns homework like he thinks his class is the only one we're taking." The conversation shifted to Tyler's academic struggles, and Julia felt the moment slip away. But part of her was relieved. The Blaze family dinner table wasn't a place for complaints or weakness. It was a place for success stories, funny anecdotes, and plans for the future. Over the next few days, Julia tried to settle back into the rhythm of home life. She helped her mother prepare for Thanksgiving dinner, went shopping with old high school friends, and attempted to enjoy the break from her demanding nursing program. But the pain made everything more difficult.
She found herself making excuses to avoid activities that might worsen it, declining a hiking trip with Marcus, begging off helping her father clean the gutters, claiming she was too tired to go Black Friday shopping with her mom. Marcus noticed her reluctance during their date night at their favorite restaurant, Rosario's Italian Kitchen, where they'd been going since high school. They sat in their usual booth, the one with the view of the mountains, sharing a plate of chicken parmesan and talking about his upcoming MCAT preparation. "You seem different," he said suddenly, pausing mid-sentence about organic chemistry. "Distant. Is everything okay with us?" Julia looked across the table at Marcus. Handsome, ambitious Marcus with his perfectly styled black hair and his earnest brown eyes behind designer glasses. He was everything her parents had hoped for in a potential son-in-law, everything she had thought she wanted in a partner. But sitting there, watching him analyze their relationship like one of his pre-med case studies, she felt an unexpected surge of frustration. "Everything's fine," she said, then immediately winced as the words came out sharper than intended. "Sorry, I haven't been feeling great lately." Marcus leaned forward, his expression shifting into what Julia had come to recognize as his future doctor face. Concerned but clinical. "What kind of not feeling great? Flu symptoms? Stress? You know stress can manifest in physical symptoms, especially during intense academic periods." For a moment, Julia considered telling him everything. Marcus was pre-med. He would understand anatomy and physiology better than her family. But something about his tone, the way he immediately jumped to stress as an explanation, made her hesitate. "It's probably nothing," she said instead, focusing on cutting her chicken into smaller pieces to avoid looking at him directly. "Some pain in my ribs. Muscle strain, probably." "Pain in your ribs." Marcus's eyebrows rose. "How long has this been going on?" "A few weeks, maybe a month." "A month?" Marcus set down his fork, his expression growing more serious. "Julia, why haven't you mentioned this before? Have you seen anyone about it?" "I don't need to see anyone about it. It's just muscle pain." Rib pain that lasts a month is not just muscle pain. It could be a stress fracture or intercostal muscle strain or even something with your organs, your liver, your spleen. Marcus was warming up to his diagnostic process, the way he always did when presented with a medical mystery. Julia felt her chest tighten, not from pain this time, but from anxiety. "Marcus, please, I know my own body. If it were something serious, I would know." "Would you, though? You're not a doctor yet. You're not even an RN yet. And sometimes the people closest to a situation are the least objective about it." The comment stung more than Julia expected. She was tired of being reminded that she wasn't qualified, that she didn't know enough, that her instincts about her own body somehow couldn't be trusted. "Can we please just drop it?"
Marcus studied her for a long moment, then nodded slowly. "Okay, but promise me that if it gets worse, you'll see someone. Your parents would want to know if you were dealing with chronic pain." That night, lying in her childhood bedroom, surrounded by high school trophies and college acceptance letters, Julia stared at the glow-in-the-dark stars she'd stuck to her ceiling when she was 12. Marcus's words echoed in her head. Her parents would want to know. Would they, though? Or would they react the way they always did when someone in the family claimed to be hurt or sick, with skepticism wrapped in concern, with suggestions to tough it out and stop dwelling on it? The real test came 2 days later during Thanksgiving dinner itself. The house was full of extended family. Robert's brother, Uncle Dave, with his wife Linda, Sarah's sister, Aunt Patricia, with her teenage twins, and Julia's grandmother, Rose, Robert's mother, who had driven down from Fort Collins for the holiday. Julia had been dreading the day all week. Large family gatherings meant lots of hugging, lots of movement, lots of opportunities for someone to accidentally bump into her ribs or for her to twist wrong while reaching for something. She'd taken 3 ibuprofen before getting dressed, hoping it would be enough to get her through the day. The pain struck during dinner preparation. Julia was helping her mother transfer the 20-pound turkey from the roasting pan to the serving platter when her group slipped. Instinctively, she twisted her body to catch the bird, and the sudden movement sent such an intense shock of pain through her chest that she cried out and dropped her end of the serving forks. "Julia!" Sarah's voice was sharp with alarm as the turkey slid partially off the platter. "What happened? Are you hurt?" The kitchen fell silent. Uncle Dave, who had been carving ham at the counter, looked up. Aunt Patricia paused in her mashing of potatoes. Even Tyler, who had been sneaking rolls from the basket, stopped mid-chew. Julia stood frozen, one hand pressed against her ribs, her face flushed with embarrassment and pain. This was it, the moment she'd been trying to avoid for weeks. Everyone was staring at her, waiting for an explanation. "I'm fine," she managed, though her voice was strained. Just pulled something." "Pulled something?" Grandmother Rose spoke up from her seat at the kitchen table, where she had been supervising the chaos with the authority of her 82 years. "Honey, you look like you're about to pass out. What's really going on?" "Nothing, Grandma Rose, I promise. Just clumsy." But Robert had noticed the way Julia was holding herself, the careful way she was breathing. His construction manager instincts kicked in. He'd seen plenty of workers try to hide injuries on job sites. "Julia, come here." "Dad, I'm fine." "Come here." His voice carried the tone that had made Julia clean her room and finish her homework throughout her childhood. "Let me look at you." Julia approached her father reluctantly, very aware that the entire family was watching. Robert placed his hands gently on her shoulders and looked into her eyes. "How long have you been in pain?" The question was asked quietly, without judgment, and for a moment Julia felt like she was 8 years old again, running to her daddy to fix a scraped knee or a broken toy. The urge to tell him everything was almost overwhelming. "A few weeks," she admitted quietly. "A few weeks?" Sarah's voice rose an octave. "Julia, Marie, Blaze, why didn't you say something?" And there it was, the reaction Julia had been dreading, the shift from concern to accusation, the implication that by not speaking up sooner, she had somehow failed them. "Because I knew you'd overreact," Julia snapped, the pain and frustration finally boiling over. "Because I knew Dad would say I need to toughen up, and you'd want to rush me to the emergency room for what's probably just a muscle strain." The kitchen erupted in a chorus of voices, Sarah insisting she never overreacted, Robert defending his parenting philosophy, Uncle Dave suggesting maybe they should call Dr. Anderson, Aunt Patricia offering her opinion about young people and their pain tolerance. Through it all, Julia stood in the center of the chaos, one hand still pressed to her ribs, realizing that the moment she'd been avoiding had finally arrived. The secret was out, but instead of relief, she felt only dread. Because now the real battle would begin, the fight to make them believe that her pain was real, that it mattered, that she deserved to be taken seriously. Grandmother Rose's voice cut through the din like a knife through butter. "Enough!" The kitchen fell silent. "Julia, sit down and tell us exactly what's been happening. No sugarcoating, no downplaying, just the truth." Julia sank into a kitchen chair, feeling suddenly exhausted. The turkey sat forgotten on the counter, the carefully planned Thanksgiving dinner in shambles. Her family gathered around her, some in chairs, some leaning against counters, all waiting for her to explain how their perfect holiday had been disrupted by something she should have handled on her own. As she began to speak, describing weeks of escalating pain and sleepless nights, Julia realized that this conversation would change everything. There was no going back to pretending everything was fine. No returning to the comfortable fiction that the Blaze family was immune to serious problems. The catalyst had been triggered, and Julia's carefully constructed world was about to come crashing down. The aftermath of Thanksgiving dinner played out exactly as Julia had feared, but somehow worse than she'd imagined. What should have been a warm family gathering became an impromptu medical consultation, with everyone offering their expertise on her condition. Uncle Dave, who had torn his rotator cuff the previous year, insisted that all muscle injuries needed immediate ice and rest. "I'm telling you, Jules, you need to stop babying it. Work through the pain. That's what my physical therapist said." Aunt Patricia, who worked as a dental hygienist, countered that any chest pain should be taken seriously. "It could be your heart, honey. Young people have heart problems too. My friend's daughter had a heart murmur nobody knew about until she was 25. Sarah paced the kitchen, alternately wringing her hands and reorganizing items that didn't need reorganizing. I should have noticed. How did I not notice my own daughter was in pain? What kind of mother am I? The kind who raised her daughter to be independent and tough, Robert said firmly, though Julia could see the worry lines creasing his forehead. Julia, why don't you take some ibuprofen and get a good night's sleep? If you're still sore tomorrow, we'll make an appointment with Dr. Anderson. Still sore? Julia stared at her father incredulously. Dad, I've been still sore for over a month. This isn't going away with a good night's sleep. Don't take that tone with your father, Sarah said automatically, her teacher voice kicking in even as she worried. But Grandmother Rose had been watching Julia carefully throughout the entire exchange. At 82, she had outlived a husband, buried a son, and raised 4 children through the Great Depression and World War II. She knew the difference between dramatics and genuine distress. Robert James Blaze, she said in the voice that had commanded respect for 8 decades, your daughter is telling you something important. The least you can do is listen without trying to fix it immediately. The room fell silent. Even Uncle Dave stopped mid-sentence about the benefits of heating pads versus ice packs. Grandmother Rose turned to Julia. Tell me about the pain, sweetheart. When does it hurt the most? Julia felt tears prick her eyes at the simple question. Finally, someone was asking about her experience rather than offering solutions. It's worst in the mornings when I first wake up, and when I laugh or cough or when I twist wrong, like what happened with the turkey. Sometimes it's just a dull ache, but other times it's so sharp I can't breathe. How's your sleep? Terrible. I can't lie on my left side anymore, which is how I've always slept. I wake up multiple times a night. And school, your clinical rotations? Julia hesitated, aware that admitting her academic performance was suffering would only add to her parents' concern. It's harder than it used to be. I get tired more easily. I can't lift patients the way I used to. Marcus, who had been silent throughout the family interrogation, finally spoke up. Julia, you should have told me it was affecting your clinical work. That's serious. Everything's serious to you, Marcus, Julia snapped, her patience finally wearing thin. Maybe I didn't tell you because I knew you'd turn it into a medical school case study. The hurt that flashed across Marcus's face made Julia immediately regret her words, but she was too exhausted and in too much pain to apologize. Okay, enough, Sarah said, her maternal instincts finally overriding her tendency to catastrophize. Julia, you're obviously hurting, and we're obviously not helping by standing around arguing about it. Let's call Dr. Anderson first thing tomorrow morning and get you checked out properly. Tomorrow's Friday, Tyler pointed out helpfully. Day after Thanksgiving. His office is probably closed. Then Monday, Robert said with finality. Julia, I want you to take it easy this weekend. No lifting, no physical activity. We'll get this sorted out. Julia wanted to laugh at the irony. Take it easy. She had been trying to take it easy for weeks while simultaneously maintaining a 3.7 GPA, completing clinical rotations, and keeping up with her part-time job. But she just nodded, too tired to fight anymore. That night, she lay in her childhood bed, staring at those same glow-in-the-dark stars, replaying the evening's events. Part of her felt relief that the secret was finally out, but a larger part felt frustrated by her family's reactions. Her father's immediate jump to tough it out, her mother's self-blame and dramatic worry, Uncle Dave's assumption that all injuries were the same, even Marcus's clinical detachment. Only Grandmother Rose had simply listened. The weekend passed in a strange limbo. Julia moved carefully through the house, hyper-aware of every twinge and ache now that her family was watching for signs of distress. Sarah hovered constantly, offering pain medication, heating pads, and endless cups of tea. Robert checked on her every few hours, asking if she was feeling better yet, as if recovery should be immediate and obvious. Tyler, to his credit, was the most normal in his behavior. He brought her movies to watch, shared gossip from his high school friends, and didn't treat her like she was fragile. You know Mom's gonna drive you crazy with the hovering, right? He said Saturday evening as they watched a Marvel movie in the living room. She means well. He does, but she's gonna want to wrap you in bubble wrap until you're 40.
Tyler glanced at her sideways. Is it really bad? The pain? Julia considered sugarcoating it for her younger brother, then decided he deserved honesty. Yeah, it's really bad. Worse than anything I've ever felt before. Tyler nodded thoughtfully. Then I'm glad you finally told them, even if Dad's being weird about it. Monday morning arrived with a fresh snowfall and an early call to Dr. Anderson's office. Sarah had clearly been waiting by the phone since 8 a.m. because she managed to secure an appointment for that afternoon. Dr. Michael Anderson had been the Blaze family physician for over 15 years. He'd treated Julia's strep throat, Tyler's broken arm, Robert's high blood pressure, and Sarah's anxiety during her mother's final illness. He was a kind man in his 60s with graying hair and the patient demeanor that came from decades of dealing with worried parents and reluctant patients. Julia sat on the examination table in the familiar office, surrounded by the same posters about hand washing and vaccination schedules she'd stared at during childhood visits. But today felt different. Today, she wasn't here for a routine checkup or a simple infection. Today, she was here because something was genuinely wrong. Dr. Anderson entered with her file, greeting Sarah and Julia with his usual warm smile. So, I understand we're having some rib pain. Tell me what's been going on.
Julia went through her story again. The onset in October, the gradual worsening, the way it affected her sleep and her studies. Dr. Anderson listened without interruption, occasionally making notes, his expression growing more serious as she spoke. Let's take a look, he said finally. Julia, I'm going to need you to remove your sweater so I can examine your ribs properly. The physical examination was thorough and uncomfortable. Dr. Anderson pressed gently along Julia's ribs, asked her to take deep breaths, had her raise her arms above her head and twist from side to side. Each movement sent familiar spikes of pain through her chest, and she couldn't help but wince and gasp. Definitely tender along the left side, Dr. Anderson murmured, more to himself than to Julia and Sarah. Julia, on a scale of 1 to 10, how would you rate your pain right now? About a 6, Julia answered honestly. It's worse in the mornings and when I move wrong. And you said this has been going on for about 6 weeks? 8 weeks now, actually. Dr. Anderson sat back down, his expression thoughtful. Julia, rib pain that persists for 8 weeks in a healthy young woman is concerning. There are several possibilities we need to consider. It could be a stress fracture, especially if you've increased your physical activity recently. It could be costochondritis, which is inflammation of the cartilage connecting your ribs to your breastbone. Or it could be related to your respiratory system. Sarah leaned forward anxiously. What would cause that? She doesn't smoke. She's always been healthy. Let's not get ahead of ourselves, Dr. Anderson said gently. The first step is imaging. I want to order chest x-rays to get a better look at what's going on. We'll also do some blood work to rule out infection or inflammation. Julia felt a strange mix of vindication and fear. Finally, someone was taking her pain seriously enough to investigate it properly. But the mention of multiple possible causes, some of which sounded serious, made her stomach clench with anxiety. Dr. Anderson, do you think I'm overreacting? My family thinks I might be making it seem worse than it is. The doctor's expression softened. Julia, you know your body better than anyone else. Pain that interferes with sleep, affects your daily activities, and persists for 2 months is not something you're imagining or exaggerating. We're going to figure out what's causing it. As they scheduled the x-rays and blood work for later that week, Julia felt something she hadn't experienced in weeks. Hope. Not hope that the pain would magically disappear, but hope that she would finally have answers, that someone would believe her, that she wouldn't have to carry this burden alone anymore. But even as relief flooded through her, a small voice in the back of her mind whispered that this was just the beginning. Getting her family to acknowledge the pain had been hard enough. What would happen when they discovered what was actually causing it? The drive home was quiet, Sarah lost in her own worried thoughts, while Julia stared out the window at the snow-covered Colorado landscape. She thought about her nursing classes, about all the times professors had emphasized the importance of listening to patients, of taking their complaints seriously, of being thorough in assessment and diagnosis. She wondered if she would be a better nurse because of this experience, or if it would make her question everything she thought she knew about pain, family, and the complicated relationship between the two. As they pulled into the familiar driveway, Julia realized that whatever the tests revealed, there was no going back to the way things were before. The careful balance of her perfectly planned life had been disrupted, and now she would have to learn to navigate a new reality, one where her body's needs might not align with her family's expectations or her own ambitions. The first step had been taken, but Julia was beginning to understand that it was going to be a much longer journey than any of them had anticipated. The radiology department at Denver Presbyterian Hospital buzzed with the quiet efficiency Julia had come to associate with medical facilities. She sat in the waiting area wearing a hospital gown that tied in the back, her regular clothes folded neatly in a plastic bag beside her chair. The X-ray appointment had been scheduled for Thursday morning, just 3 days after her visit with Dr. Anderson, but those 3 days had felt like an eternity. Sarah sat beside her, fidgeting with her purse strap and checking her phone repeatedly. She had taken a personal day from teaching, something she rarely did, and Julia could sense her mother's nervous energy radiating across the small space between them. "Julia Blaze," a technician in navy blue scrubs appeared with the clipboard, "we're ready for you." The X-ray process was surprisingly quick and impersonal. The technician, a middle-aged woman named Carol, positioned Julia against a cold metal plate and instructed her to hold her breath while the machine hummed and clicked. Different angles, different positions, deep breaths, and held breaths, all while Julia tried not to think about what the images might reveal. "When will we know the results?" Julia asked as Carol helped her down from the table. "Dr. Anderson should have them by tomorrow afternoon," Carol replied with practiced efficiency. "He'll call you to discuss the findings." Back in the waiting area, Sarah looked up expectantly as Julia emerged. "How was it?" "Fine, quick. We should know something tomorrow." The drive back to Lakewood was filled with Sarah's nervous chatter about everything except the X-rays. Tyler's upcoming basketball game, the new curriculum changes at her school, her plans to redecorate the guest bathroom. Julia recognized this as her mother's coping mechanism, the way Sarah dealt with situations beyond her control. That evening, Robert attempted his own version of supportive parenting by suggesting they all watch a movie together, something they hadn't done as a family in months. He made popcorn and let Julia choose the film, small gestures that showed he was trying, even if he didn't quite know how. But Julia found it impossible to concentrate on the romantic comedy Tyler had vetoed in favor of an action thriller. Every time she shifted position on the couch, every time she laughed at one of the jokes, every time she took a deep breath, she was reminded of the persistent ache in her ribs and the questions that would be answered tomorrow. Marcus called that night, his voice careful and measured over the phone. Their relationship had been strained since her outburst on Thanksgiving, and Julia could hear him trying to navigate the conversation without saying the wrong thing. "How did the X-rays go?" "They went. We'll know more tomorrow." "I've been reading about rib injuries," Marcus said, and Julia could practically hear him consulting his notes. "Did you know that stress fractures can occur from repetitive motion or sudden impact? They're more common in athletes, but they can happen to anyone." Julia closed her eyes, leaning back against her headboard. "Marcus." "And costochondritis, that's inflammation of the cartilage, can be caused by viral infections, physical strain, even coughing fits. The good news is that most rib injuries heal with conservative treatment." "Marcus, stop." There was silence on the other end of the line. "I appreciate that you're trying to help," Julia said more gently, "but I don't need you to research my condition for me. I need you to just be my boyfriend, not my future doctor." "I am being your boyfriend. This is how I show I care, by learning about what you're going through." "But that's not what I need right now. I need someone to listen when I'm scared, not someone to give me a medical lecture. Another pause. Are you scared? The question was so simple, so direct, that it caught Julia off guard. She'd been so focused on defending her pain, on proving it was real, on managing everyone else's reactions, that she hadn't allowed herself to acknowledge her own fear. Yes, she whispered. I'm terrified. Of what? Julia stared at the ceiling, at those glow-in-the-dark stars that had witnessed so many of her childhood worries and teenage anxieties. Of what they might find, of what it might mean for school, for my future, of my parents being right that I'm overreacting, or being wrong and it being something serious. I'm scared that this pain might never go away. For the first time in their conversation, Marcus was quiet, really listening instead of formulating his next response. I'm scared too. I hate seeing you hurt. I hate that I can't fix it. Friday afternoon arrived with agonizing slowness. Julia had returned to Boulder for her classes, but found herself checking her phone constantly, waiting for Dr. Anderson's call. She was sitting in her advanced pathophysiology lecture, ironically learning about inflammatory conditions, when her phone buzzed with his number. She slipped out of the lecture hall and found a quiet corner in the hallway to take the call. Julia, this is Dr. Anderson. I have your X-ray results, and I'd like you to come in this afternoon to discuss them. Can you be here around 3 o'clock? Julia's heart rate spiked. Can't you just tell me over the phone? I prefer to discuss results in person, and I'd like your mother to be there as well, if possible. The careful neutrality in his voice told Julia everything she needed to know. Good news was delivered quickly, casually, over the phone. Bad news required appointments, conversations, presence. I'll be there, she said, her voice steady despite the fear clawing at her chest. The drive from Boulder to Dr. Anderson's office in Lakewood felt like the longest 45 minutes of Julia's life. She called her mother from the car, and Sarah's reaction, immediate panic followed by determined deficiency, confirmed Julia's suspicions that something significant had been found. Dr. Anderson's office felt different this time. The same cheerful posters and comfortable chairs, but now Julia saw them through the lens of someone receiving potentially life-changing news. Sarah arrived 5 minutes after Julia, still in her teaching clothes, her hair slightly disheveled from rushing. Dr. Anderson entered with a manila folder and an expression that was professional but kind. He settled behind his desk and opened the folder, revealing Julia's X-rays clipped to a light board. Julia, the X-rays show something I wasn't expecting, he began, his voice gentle but serious. You have 3 fractured ribs on your left side. The fractures appeared to be several weeks old, which matches your timeline of symptoms. The words hit Julia like a physical blow. Fractured ribs. 3 of them. Not muscle strain, not stress, not psychosomatic pain that she was imagining or exaggerating. Actual broken bones.
Fractured? Sarah's voice was barely a whisper. How? She hasn't been in an accident. She hasn't fallen. That's what we need to figure out, Dr. Anderson said. Rib fractures in healthy young adults are unusual. They typically result from significant trauma, car accidents, falls, direct impact to the chest. The pattern of fractures here is consistent with a compressive force, as if something pressed against Julia's ribs with considerable pressure. Julia stared at the X-ray images, at the clear white lines that ran through 3 of her ribs like cracks in ice, the evidence of her pain made visible, undeniable, real. But I don't remember anything like that happening, she said, her mind racing through the past few months. I haven't been in any accidents. I haven't fallen or been hit by anything. Dr. Anderson leaned forward slightly. Julia, I need to ask you some difficult questions, and I want you to know that this is a safe space. Sometimes rib fractures like these can be the result of physical violence. Has anyone hurt you? hit you, pushed you, squeezed you in a way that might have caused this injury? The implication hung in the air like a toxic cloud. Julia saw her mother's face go white, saw the way Sarah's hands gripped the arms of her chair. "No," Julia said firmly. "No, nothing like that has happened. My boyfriend would never hurt me. My family would never hurt me. I haven't been attacked or assaulted." "I had to ask," Dr. Anderson said gently. "It's part of my responsibility as your physician. Now, let's think about other possibilities. Have you been doing any new physical activities? Heavy lifting? Contact sports?" Julia thought back over the months leading up to October. "I stopped playing volleyball after high school. I go to the gym sometimes, but nothing intense. I work at a clinic part-time, but it's mostly filing and scheduling. I do clinical rotations at the hospital, but we're not supposed to lift patients alone." "What about CPR training?" Dr. Anderson asked. "Chest compressions can sometimes cause rib fractures, especially if they're performed with too much force or for an extended period." Julia's eyes widened. "We did CPR recertification in September. It was a full-day course with lots of practice on mannequins." She paused, memory crystallizing. "There was one session where I was paired with this guy, Brad something, who was really intense about it. He kept saying we weren't pushing hard enough, that in a real emergency, we needed to compress deeper. He actually took over during one of my practice rounds and showed me how much force to use." Sarah leaned forward. "You think someone broke her ribs during a CPR class?" "It's possible," Dr. Anderson said. "Rib fractures are actually not uncommon during CPR, both in training scenarios and in real-life situations. The force required for effective chest compressions, at least 2 inches deep, can fracture ribs, especially if the person performing compressions is significantly larger or stronger than the recipient." Julia felt a strange mix of relief and anger. Relief that there was an explanation, that she hadn't somehow missed a major trauma in her own life, but anger that something meant to save lives had instead caused her months of pain and doubt. "So, what now?" Sarah asked. "How do we fix this?" The good news is that rib fractures generally heal on their own with time and proper care. The bad news is there's not much we can actively do to speed the process. No casts, no surgery for simple fractures like these. We focus on pain management and preventing complications. He went on to explain the treatment plan: stronger pain medication, breathing exercises to prevent pneumonia, restrictions on heavy lifting and strenuous activity. He also mentioned that healing could take 6 to 8 weeks from the time of initial treatment, which meant Julia was looking at potentially months more of limited activity. "What about school?" Julia asked, thinking of her clinical rotations, her demanding course load, her carefully planned timeline for graduation. "You'll need to work with your program director to modify your clinical requirements. No lifting patients, limited physical activity. Some programs allow students to make up missed clinical hours or focus on documentation and observation rather than hands-on care." As they discussed the practical implications, follow-up appointments, work restrictions, academic accommodations, Julia felt overwhelmed by the complexity of what should have been a simple answer. Yes, she was hurt. Yes, it was real. But knowing what was wrong somehow made everything more complicated, not less. The drive home was quiet, both women lost in their own thoughts. Finally, Sarah broke the silence. "I owe you an apology," she said quietly. "We all do. You were telling us something was wrong, and we didn't listen. We didn't take you seriously." Julia looked over at her mother, seeing the guilt and regret etched in her face. "You couldn't have known it was fractures." "But we could have listened better. We could have gotten you help sooner." Sarah's voice cracked slightly. "I kept thinking you were being dramatic, that you were stressed about school and it was manifesting physically. I'm supposed to protect you, and instead I made you feel like you couldn't trust your own body." The truth Julia had been avoiding for weeks was finally happening, but not in the way she'd expected. She'd thought it would be about proving her pain was real. Instead, it was about something much deeper, about trust, about being heard, about the complicated ways families could hurt each other while trying to help. "I'm sorry," Julia said too. "I should have been clearer about how bad it was. I should have insisted on seeing a doctor sooner." "You shouldn't have had to insist," Sarah said firmly. "That's on us." As they pulled into their driveway, Julia realized that getting the diagnosis was just the beginning. Now came the harder part, healing not just her ribs, but the trust that had been damaged along the way, learning to navigate a new relationship with her body, her family, and her own instincts about what she needed and deserved. The truth had set her free, but freedom, Julia was discovering, came with its own set of challenges.
The University of Colorado nursing program office smelled like industrial coffee and stress. Julia sat across from Dr. Patricia Hawkins, the program director, clutching Dr. Anderson's medical documentation in her hands. The official letterhead made everything feel more real and more daunting. Patient requires modified clinical duties due to multiple rib fractures, no lifting over 10 pounds, limited physical activity for 6 to 8 weeks. Dr. Hawkins, a stern woman in her 50s with silver hair pulled back in a tight bun, reviewed the documents with the same intensity she brought to reviewing student performance evaluations. Julia had always found her intimidating, but today that intimidation felt magnified by her vulnerability. 3 fractured ribs, Dr. Hawkins said, looking up over her reading glasses. "From CPR training, you said?" "That's what my doctor thinks is the most likely cause," Julia replied, her voice steadier than she felt. "And this has been ongoing for how long?" "About 10 weeks now." Dr. Hawkins made a note in Julia's file. "Miss Blaze, I'll be frank with you. This puts us in a difficult position. Clinical rotations are not optional components of your nursing education. They're required by the state board, and they involve hands-on patient care. We can't simply excuse you from these requirements." Julia felt her stomach drop. "I'm not asking to be excused. I'm asking for modifications. I can still observe, assist with documentation, participate in patient education. But you can't perform the physical aspects of nursing care. You can't help transfer patients, assist with mobility, perform chest compressions if needed. These aren't peripheral skills, Miss Blaze. They're core competencies." The implications hit Julia like a freight train. "Are you saying I can't continue in the program?" Dr. Hawkins softened slightly, perhaps recognizing the panic in Julia's voice. "I'm saying we need to explore our options carefully. You're in your 3rd year, which means you have significant clinical hours still to complete. We could potentially arrange for you to audit certain rotations, focusing on observation and learning rather than hands-on practice. But you'd likely need to extend your program by at least 1 semester to make up the practical requirements once you're fully healed." 1 semester. 6 months. Julia's carefully planned timeline, graduation next spring, taking the NCLEX in summer, starting her nursing career by fall, crumbled before her eyes. "There's another issue," Dr. Hawkins continued. "Your clinical supervisor, Mrs. Thompson, has expressed concerns about your recent performance. She noted that you've been avoiding physical tasks, appearing tired and distracted. She was planning to discuss this with you regardless of your injury." Julia's cheeks burned with embarrassment. Margaret Thompson had been watching her struggle for weeks, had even called her out about moving like she was made of glass. Now Julia understood that her attempts to protect herself had been interpreted as laziness or lack of commitment. "I was in pain. I was trying to manage it while still fulfilling my responsibilities." "I understand that now. But at the time, Mrs. Thompson saw a student who wasn't meeting expectations. This injury explains your behavior, but it doesn't erase the clinical hours where you weren't performing at the required level." Julia left the meeting with a modified clinical schedule that felt like a consolation prize. She would continue with her current hospital rotation, but strictly in an observational capacity. She could attend lectures and complete theoretical assignments, but her hands-on training was effectively suspended until further notice. The news hit her family differently than she expected. Robert, surprisingly, was the most supportive. "Sometimes life throws you curveballs," he said over dinner that evening. "The important thing is how you adjust your swing. So you graduate a semester later. So what? You'll still be a nurse." Sarah was less philosophical.
"This is all my fault," she said for perhaps the 100th time since the diagnosis. "If I had listened to you sooner, if I had insisted on medical attention weeks ago." "Mom, stop." Julia set down her fork, frustrated by her mother's persistent guilt. "Even if we'd caught it earlier, I still would have needed time to heal. The outcome would be the same." But Tyler, now 17 and more perceptive than his parents sometimes realized, cut straight to the heart of the matter. "Are you okay with this? Delaying graduation?" Julia looked at her younger brother, surprised by his directness. "Do I have a choice?" "There's always a choice. Maybe not a good one, but there's always a choice." That night, Julia called Marcus to share the news about her academic delays. His response was immediate and practical. "Have you considered taking a medical leave of absence? You could use this time to focus on healing completely, maybe get some work experience in a non-clinical setting. Some hospitals hire nursing students as unit clerks or patient care assistants." "That would mean being a year behind you instead of 6 months," Julia pointed out. "So what? We don't have to graduate at the same time. We don't have to follow the same timeline for everything." There was something in his tone that made Julia pause. "Marcus, are you trying to tell me something?" A long silence stretched across the phone line. "I've been thinking about our conversation the other night, about how I turn everything into a medical case study, how I'm not giving you what you actually need. You're learning. We both are." "Maybe, but I think we might need to take a step back. From us. Just temporarily," he added quickly, "until you figure out what you need and I figure out how to be better at supporting you." The words hit Julia harder than she expected. "You're breaking up with me while I'm dealing with fractured ribs and potentially having to repeat a year of school?" "I'm not breaking up with you. I'm suggesting we take a break. There's a difference." "Is there? Because it feels like you're abandoning me when things get complicated." "That's not—" Marcus stopped himself. "Maybe that's exactly what I'm doing. Maybe that proves we both need some time to figure things out." After hanging up, Julia sat in her childhood bedroom feeling like her entire life was unraveling. Her academic plans were derailed, her relationship was on pause, her body was betraying her with persistent pain that would take months to fully resolve. The independence and control she'd worked so hard to build felt like illusions. But the real test came the following week when she returned to her clinical rotation at Denver General Hospital. Walking through those familiar hallways in street clothes instead of scrubs, carrying a notebook instead of a stethoscope, felt like wearing a scarlet letter that announced her limitations to everyone she passed. Margaret Thompson met her at the nurses' station with a mixture of professional courtesy and barely concealed skepticism. "So, observational learning," she said, reviewing Julia's modified assignment sheet. "No patient contact, no physical assessments, no hands-on procedures."
That's right. What exactly will you be doing for 8 hours? It was a fair question, and one Julia had been dreading. Documentation review, care plan analysis, patient education preparation, observing procedures, and discussing the rationale behind different interventions. Margaret's expression suggested she found this about as useful as Julia feared she would. "Well, let's start with room 314. Elderly male, post-operative hip replacement. You can observe while I do his morning assessment." The next several hours were among the most frustrating of Julia's nursing education. She watched Margaret efficiently move through patient assessments, medication administration, and care coordination, all tasks that Julia should have been learning to perform herself. Instead, she stood awkwardly to the side, taking notes and trying to ask intelligent questions that proved she was engaged and learning. During lunch break, she sat alone in the hospital cafeteria, watching other nursing students from different programs, confidently discussing their morning procedures, their successful IV insertions, their interactions with attending physicians. Julia felt like she was watching her future career through a window she couldn't open. "Rough morning?" Julia looked up to find Dr. Lisa Chen, one of the residents she'd met during previous rotations. Lisa was Marcus's older sister, though she'd always been friendly to Julia, independent of that connection. "You could say that," Julia replied, gesturing to the empty chair across from her. Lisa sat down with her salad and coffee. "Marcus mentioned you're dealing with some injuries. Fractured ribs?" "3 of them, from CPR training, apparently." "Ouch. That's unfortunately more common than people realize. How are you handling the clinical restrictions?"
Julia found herself explaining her frustrations to Lisa. The observational-only status, the delayed graduation, the feeling that she was falling behind her peers. Lisa listened with the kind of focused attention that Julia had been craving from everyone else in her life. "Can I tell you something?" Lisa said when Julia finished. "Some of the best nurses I work with are the ones who've experienced significant illness or injury themselves. They understand patient vulnerability in a way that textbooks can't teach. This experience you're having, feeling helpless, having your body limit your activities, dealing with people who don't fully understand your pain, it's horrible to live through, but it's also invaluable education. It doesn't feel valuable. It feels like I'm being left behind." Left behind by what? Some arbitrary timeline? Julia, you're 22 years old. Whether you graduate this spring or next fall, you'll still have a 40-year nursing career ahead of you. 6 months is nothing in the context of a lifetime. Lisa's words were logical and comforting, but they couldn't erase Julia's frustration with her current limitations. That afternoon, during a particularly complex patient care scenario that she could only observe, Julia felt tears of frustration burning behind her eyes. The patient was a young woman, maybe 25, who had been in a car accident. She was awake and alert, but clearly in significant pain, asking repeatedly for her nurse to, "Please help me, something's not right." Julia watched Margaret assess the woman, noting changes in vital signs and symptoms that suggested potential internal hemorrhaging. "What's your assessment?" Margaret asked Julia quietly while the patient was distracted by a phone call. Julia reviewed her observations. Dropping blood pressure, increasing heart rate, patient reports increasing abdominal pain. I'd be concerned about internal hemorrhaging. Good. What would be your next steps? Immediate physician notification, preparation for potential surgical intervention, continuous monitoring, possible blood type and crossmatch. And who would implement those interventions? Julia understood the point Margaret was making. Not me, because I can't perform hands-on care right now. That's right. You can identify the problem, you can understand the solution, but you can't actually help solve it. That has to be frustrating for someone who chose nursing because she wants to help people. It was the first time Margaret had acknowledged Julia's situation with something approaching empathy rather than professional irritation. But it also crystallized Julia's deepest fear, that her injury hadn't just delayed her education, it had revealed fundamental limitations that might always hold her back. As she drove home that evening, Julia realized that learning to cope with her diagnosis was proving much more complex than simply managing physical pain. She was having to reconstruct her identity, her timeline, her relationships, and her expectations for the future. The obstacles weren't just medical, they were psychological, social, and deeply personal. The fractured ribs were healing slowly, but predictably. The fractured sense of self would take much longer to repair.
February in Colorado brought a brutal cold snap that seemed to settle into Julia's bones and make her rib pain worse. She stood outside the university's financial aid office, staring at the letter in her hands with growing dread. The words academic probation and financial aid suspension jumped off the page like accusations. Her extended medical leave had triggered a review of her student aid eligibility. Since she was no longer enrolled full-time and her graduation had been delayed indefinitely, the university was suspending her grants and loans pending a formal appeal process. The letter estimated her current debt at $47,000, with no clear path to funding the additional semesters she'd need to complete her degree. Julia's hands shook as she read the details, and not from the cold. Without financial aid, she couldn't afford tuition. Without completing her degree, she couldn't become a nurse. Without becoming a nurse, she couldn't pay back the loans she'd already accumulated. It was a perfect spiral of impossibility. Her phone buzzed with a text from her supervisor at the clinic where she'd been working part-time. "Julia, we need to discuss your recent absences. Can you come in this afternoon?" Another shoe dropping. Julia had been struggling to maintain even her minimal work schedule due to pain flares and medical appointments. What had once been a manageable balance between school, work, and health had become an impossible juggling act. She drove to the Lakewood family clinic with the financial aid letter burning a hole in her purse. The clinic was a modest medical facility in a strip mall, the kind of place that served working families who couldn't afford concierge medicine but needed more than urgent care. Julia had worked there for 2 years, primarily doing filing, appointment scheduling, and basic patient intake. Dr. Rebecca Martinez, the clinic's owner and Julia's boss, was a no-nonsense woman in her 40s who had built her practice from nothing. She'd always been fair to Julia, working around her class schedule and understanding about the demands of nursing school. "Sit down, Julia," Dr. Martinez said, gesturing to the chair across from her cluttered desk. "We need to talk about your employment status." Julia's heart sunk. "I know I've missed some shifts lately. My injury has been—" "I'm not firing you," Dr. Martinez interrupted gently, "but I am concerned. You've missed 8 days in the past 6 weeks. When you are here, you're clearly in pain. Yesterday, Mrs. Patterson mentioned that you seemed confused when scheduling her follow-up appointment." Julia remembered the incident. The elderly woman had needed a cardiology consultation, and Julia had accidentally scheduled her with dermatology instead. It was the kind of mistake she'd never would have made 6 months ago. But lately, her concentration was scattered, her focus compromised by chronic pain and the stress of her deteriorating situation. "I can do better," Julia said, though even as she spoke the words, she wasn't sure they were true. Dr. Martinez leaned forward, her expression softening. "Julia, I've known you for 2 years. You're one of the most dedicated students I've ever employed. But right now, you're not operating at full capacity, and that's understandable given what you're dealing with. What's not understandable is why you're pushing yourself to the breaking point instead of taking the time you need to heal." "Because I can't afford to take time," Julia said, her voice breaking slightly. "I just found out my financial aid has been suspended. If I don't work, I can't pay my bills. If I can't pay my bills, I'll have to drop out of school entirely." Dr. Martinez was quiet for a long moment, studying Julia's face. "What does your family say about this situation?" Julia laughed bitterly. "They don't know about the financial aid issue yet. They're already feeling guilty enough about not taking my pain seriously initially. I can't add this to their burden." "So you're handling a major financial crisis, chronic pain, academic delays, and employment problems entirely by yourself?" When Dr. Martinez put it that way, Julia realized how unsustainable her situation had become. She was drowning, but she'd been so focused on not pulling anyone else underwater with her that she'd forgotten to ask for help staying afloat. "I have an idea," Dr. Martinez said. "What if we restructured your position here? Instead of general clinic support, what if you became our patient education coordinator? It would be more hours, better pay, and work that uses your nursing knowledge without requiring physical strain." Hope flickered in her chest for the first time in weeks. What would that involve? Developing educational materials for our diabetic patients, hypertension management classes, medication compliance counseling, mostly sitting work, but meaningful work that would actually enhance your nursing education. The position would pay enough to cover her basic living expenses, though not tuition. It was a lifeline, but not a complete solution to her financial crisis. That evening, Julia sat in her car outside her family's house, trying to summon the courage to go inside and tell them about the financial aid situation. Through the kitchen window, she could see her parents preparing dinner, Tyler doing homework at the table, the picture of domestic normalcy she'd grown up taking for granted. Her phone rang. Marcus. They hadn't spoken since their break conversation 3 weeks ago, and seeing his name on the screen triggered a complex mix of emotions: longing, anger, relief, and frustration, all tangled together. "Hi," she answered cautiously. "Hi, I know we're not really talking right now, but Lisa mentioned she ran into you at the hospital and she was worried about you." Julia felt a flash of irritation. She was worried enough to call you instead of calling me directly? "She did call you, multiple times. You haven't been answering." Julia checked her phone and realized she had several missed calls from Dr. Lisa Chen spanning the past few days. In her fog of stress and pain, she'd been screening all calls except family and work.
"I've been dealing with some things," Julia said. "What kind of things?" The question was asked with genuine concern, not clinical detachment, and Julia found herself explaining everything: the financial aid suspension, the academic probation, the work situation,
the growing sense that everything in her life was falling apart simultaneously. Marcus was quiet while she spoke, and for once, he didn't interrupt with medical explanations or potential solutions. When she finished, he was silent for a long moment. "Jesus, Julia, why didn't you tell me about any of this?" "Because we are on a break, remember? Because you decided you couldn't handle being supportive when things got complicated." "That's not what I said. It's what you did." Another silence. "You're right. I'm sorry. I thought I was being mature and giving you space to figure things out, but really I was just being a coward. I was scared of saying the wrong thing, so I said nothing at all." Julia felt tears building behind her eyes. "I needed you, Marcus. I needed my boyfriend, not my future doctor or my space or your mature perspective on relationships. I needed someone who cared enough to fight through the awkwardness and be there anyway. I know. I screwed up. I'm screwing up right now by calling instead of driving over there." Despite everything, Julia smiled slightly. "Where are you?" "Sitting in my car outside your parents' house." Julia looked in her rearview mirror and saw Marcus's Honda Civic parked 3 houses down the street. The sight of him there, having driven over without being asked, broke something loose in her chest. "This is really weird, Marcus." "I know, but I missed you, and Lisa said you looked like you needed someone in your corner, and I realized I want to be that person even if I'm not very good at it yet." They met on the sidewalk between their cars, and Marcus pulled her into a hug that was careful of her ribs, but fierce in its intention. Julia buried her face against his shoulder and let herself cry for the first time in weeks, not just from pain, but from relief at not having to carry everything alone. "We need to tell my parents about the financial aid thing," she said when she could speak again. "We? If you want to be in my corner, this is what it looks like. Family dinner conversations about money and failure and disappointing everyone." Marcus took her hand. "Okay, let's go disappoint some people together." But as they walked up the driveway toward the warm light spilling from the kitchen windows, Julia realized this might be her lowest point, but it was also the first time in months that she didn't feel completely alone in facing it. The real crisis wasn't the financial aid or the academic delays, or even the persistent pain in her ribs. The real crisis had been trying to handle everything by herself, believing that asking for help was the same as admitting defeat. Now, standing at her family's front door with Marcus beside her and the truth about her situation ready to be shared, Julia understood that sometimes you had to admit you were drowning before anyone could throw you a rope. The hardest part wasn't hitting rock bottom. The hardest part was learning to trust that people might still love you there. The Blaze family kitchen had never felt smaller than it did that February evening when Julia and Marcus walked through the door hand in hand, carrying the weight of revelations that would change everything. Sarah looked up from stirring pasta sauce, her face immediately shifting from surprise at seeing Marcus to concern at Julia's tear-stained cheeks. "What's wrong?" Robert asked, rising from the table where he'd been helping Tyler with calculus homework. Julia took a shaky breath and pulled the financial aid letter from her purse. "We need to talk. All of us." What followed was the most honest conversation the Blaze family had ever had. Julia laid out everything: the suspended financial aid, the academic probation, her struggle to maintain her work schedule while managing chronic pain, her fear that she'd never become the nurse she dreamed of being. She told them about feeling like a burden, about trying to protect them from worrying, about the shame of needing help when she'd always been the responsible one. Robert's reaction surprised everyone, especially Julia. Instead of lecturing about financial responsibility or pushing her to figure it out, he was quiet for a long time, then asked simply, "What do you need from us?" "I need to know that you believe in me," Julia said, her voice barely above a whisper. "I need to know that if it takes me an extra year to graduate, if I have to find a different path, if I'm not perfect anymore, you'll still be proud of me." Sarah was crying openly now. "Oh, sweetheart, We've been so focused on your achievements that we forgot to tell you we love you, regardless of what you achieve." Tyler, who has been quietly absorbing the adult conversation swirling around him, spoke up with the directness that only teenage brothers possessed. "Jules, you literally have 3 broken ribs, and you've been going to school and work this whole time. How is that not tough enough for anyone?" The simple observation from his 17-year-old brother cut through months of self-doubt more effectively than any pep talk could have. Over the next several hours, the family developed a plan. Robert and Sarah would help cover Julia's living expenses while she appealed the financial aid suspension. Julia would accept Dr. Martinez's offer to become the patient education coordinator, using the better pay and reduced physical demands to focus on healing while contributing meaningful work. Most importantly, she would stop trying to handle everything alone. "But I want to be clear about one thing," Robert said as the evening wound down. "This isn't charity. This is investment. We're investing in your future because we believe in you, but also because we know you'll do the same for Tyler someday, or for your own kids, or for patients who need an advocate." The breakthrough came not in a single moment of revelation, but in the weeks that followed, as Julia learned to accept help while rebuilding her sense of purpose. Her new role at the clinic proved to be perfect timing. The work challenged her intellectually without requiring physical strain, and she discovered she had a gift for patient education that she'd never recognized before. Mrs. Eleanor Davidson was Julia's first major success. The 73-year-old diabetic had been struggling to manage her blood sugar levels despite multiple medications. During their initial consultation, Julia realized that Mrs. Davidson wasn't non-compliant. She was overwhelmed by conflicting information from various healthcare providers. "Everyone tells me something different," Mrs. Davidson confided during their second meeting. "Dr. Smith says no carbs, Dr. Johnson says complex carbs are okay, the nutritionist gave me a meal plan I can't afford, and my daughter keeps sending me articles about diabetes cures she found on Facebook." Julia spent the next hour helping Mrs. Davidson organize all her medical information, create a simple meal plan within her budget, and develop a system for tracking her blood sugar that didn't require smartphone apps or complicated charts. Within 6 weeks, Mrs. Davidson's A1C levels had improved dramatically. "You saved my life," Mrs. Davidson told Julia during a follow-up appointment. "Not just medically, but you made me feel like I could actually manage this disease instead of it managing me." The comment resonated deeply with Julia, who was learning to manage her own condition, not just the physical aspects of healing ribs, but the emotional work of rebuilding confidence and redefining success. Her academic appeal was successful, thanks in part to Dr. Hawkins' support and a detailed letter from Dr. Anderson documenting the severity of Julia's injury and the impact on her academic performance. Financial aid was reinstated with the understanding that Julia would complete her degree on an extended timeline that accommodated her recovery. But the most significant breakthrough came during a conversation with Grandmother Rose in April, as spring finally began to soften Colorado's harsh winter edges. They were sitting on the back porch, watching Sarah plant her annual vegetable garden, when Rose asked Julia a question that changed everything. "Do you think this experience has made you a better person or a worse person?" Julia considered the question seriously. 6 months ago, she would have said worse. Weaker, more dependent, less capable. But sitting there, watching her mother carefully tend seedlings that would need months of care before bearing fruit, Julia realized something important. "Better," she said finally. "I understand things now that I couldn't understand before. What it feels like when people don't believe you're really hurt, what it's like to need help and be afraid to ask for it, what it means to have your body limit what you can do even when your mind is willing. And how will that make you a better nurse?" Julia smiled, understanding where her grandmother was leading her. "Because I'll listen differently. I'll believe patients when they tell me something's wrong, even if I can't immediately see what it is. I'll understand that healing isn't just physical, it's emotional and social too." Exactly. Sometimes the worst things that happen to us become our greatest strengths, but only if we're willing to learn from them instead of just surviving them.
By June, Julia's ribs had healed completely. The physical pain that had dominated her life for 8 months was finally gone, leaving behind only occasional soreness on cold mornings or after particularly long days. But more importantly, she had developed new strengths: the ability to advocate for herself, to accept help gracefully, and to see setbacks as redirections rather than failures. Her academic appeal was successful, thanks in part to Dr. Hawkins' support and a detailed letter from Dr. Anderson documenting the severity of Julia's injury and the impact on her academic performance. Financial aid was reinstated with the understanding that Julia would complete her degree on an extended timeline that accommodated her recovery. Her return to full clinical duties in the fall was triumphant in ways she never could have anticipated. The observational learning that had initially felt like punishment had actually given her a deeper understanding of patient care dynamics. Her experience as a patient education coordinator developed communication skills that made her stand out among her peers. Most significantly, her personal experience with injury and medical dismissal made her exceptionally sensitive to patient needs and concerns.
Margaret Thompson noticed the change immediately. "You're different," she told Julia during her first week back on clinical rotation. "More confident, but also more compassionate. Whatever happened during your recovery, it's made you a better student nurse." Julia graduated 18 months later than originally planned, but with honors and a job offer from Denver General Hospital's cardiac unit. At her graduation ceremony, she looked out at her family in the audience, Robert and Sarah beaming with pride, Tyler trying to look cool while secretly excited for his sister, Grandmother Rose nodding with satisfaction, Marcus cheering despite his usual reserved demeanor. The journey had been longer and more difficult than anyone had anticipated, but it had also been transformative in ways that following the original plan never could have been. In her valedictorian speech, Julia chose to talk about the difference between healing and curing. "Curing is what happens when medicine fixes what's broken in your body," she told her fellow graduates. "Healing is what happens when you learn to integrate that experience into who you're becoming. Sometimes the most important healing happens not in spite of our struggles, but because of them." After the ceremony, as families gathered for photos and celebrations, Dr. Lisa Chen approached Julia with a smile. "I have a confession," she said. "When I first met you in the hospital cafeteria, I was worried you might not make it through nursing school. Not because you weren't smart enough or dedicated enough, but because you seemed so fragile, breakable." Julia laughed. "I was breakable. I had 3 broken ribs." "No, I mean emotionally. You seemed like someone who hadn't been tested yet, who might crumble when faced with real adversity." "And now?" Lisa's smile widened. "Now, I think you're going to be the kind of nurse who changes patients' lives, the kind who understands that healing is about more than medical interventions, the kind who listens not just to what patients say, but to what they're afraid to say." As Julia looked around at the celebration surrounding her, her family's joy, Marcus's proud smile, the friendships forged through shared struggles, the opportunities stretching ahead of her, she realized that Rose had been right. The worst thing that had happened to her had indeed become one of her greatest strengths. The pain was real, the dismissal was devastating, the setbacks were significant, but the growth that emerged from those challenges had prepared her for a nursing career that would be deeper, more meaningful, and more impactful than anything she could have achieved by following the easier path. Sometimes, Julia reflected as she pinned her new RN badge to her scrubs for the first time, the most important lessons can only be learned the hard way. And sometimes, being broken is just the first step toward becoming whole in ways you never knew were possible. Her story wasn't about overcoming adversity. It was about being transformed by it. And that transformation would benefit every patient she would care for throughout her career, every family she would support, and every colleague she would teach to truly listen. The 3 fractured ribs had healed completely. The fractured trust, rebuilt stronger than before, would last a lifetime. Up next, you've got 2 more standout stories right on your screen.
If this one hits the mark, you won't want to pass these up. Just click and check them out. And don't forget to like, subscribe, and turn on the notification bell so you don't miss any upload from us.